Good morning. My name is Hilary Daniel. I'm an associate for health policy at the American College of Physicians. I'm here at the annual meeting 2019 and moderated a panel on social determinants of health titled Improving Individual and Community Health by Addressing Social Determinants of Health. At that panel, we had 3 panelists coming from different areas, people who have worked in government, who have worked in public policy areas, and who work in medical education, to look at how physicians and other healthcare workers can engage on this issue and really start to address the social determinants of health that are affecting patients across the country. There were several frameworks that were discussed during the panel, which were very interesting, about how to tackle the issue of social determinants of health from the perspective of a clinician. It can seem like a daunting issue when there are so many different things that physicians see every day. They see many, many patients, but there are tools and strategies out there to look at social determinants of health and start to address them in their patient populations, even just starting with one patient. It doesn't have to be 1,000 patients, which is a theme that started to occur throughout the presentation, is taking the first step. It can feel daunting. There are many responsibilities that physicians have nowadays, and it can seem like this might be something that is too big for them to deal with, but there are ways in which to do that. An interesting part of the presentation is when Elaine Waxman really went into the issue of food insecurity and how food can affect health. She talked about how the issue of food insecurity, it's one of those social determinants that's often shielded and not seen. It's an invisible social determinant, if you will. Dr. Horace Delisier, who works here in Philadelphia, he talked about the need for the importance of relationships between physician and patient, and how to understand the physician, or understand where the patient is coming from, understand where you're coming from as a physician, and how those stories, how those lived experiences interact, and how to be clinically and culturally and socially competent and sensitive and empathetic toward patients. Sandy Magnan, who had previously worked in Minnesota and works currently, or is on the board, works with NASM, or the National Academies of Sciences, Engineering, and Medicine, on social determinants issues, provided a few really interesting frameworks about how to start to tackle social determinants within your clinical setting or within your healthcare space. Looking at, you need to, at first, just understand where people are coming from, identify the problems, look at the problems, study them, see what's going on, act on those, and then refine your programs or other things that are going to help your patients throughout the day. We had a really great discussion at the end of it, a lot of questions. The audience was incredibly engaged, addressing issues from how climate change could affect food insecurity because of issues with crops, to how physicians can be more culturally competent within their own practices.